nobody published before on these topics. We had for detection of the cancer, we developed a number of the methods, and we were mainly using laser beam, but they had a lot of the limitations, and then I had an idea that if electrocardiograms have a high frequency component, this may have a possibility to pick up any information in the rest of the body. So we started doing research on this, and finally, end of the last year, I succeeded to find out we can detect this. And so we are going to show some of our finding to get some idea. These are related to laser beam cancer diagnostic method by non-invasive techniques. But due to their limitation, we abandoned it. Now, these are some of the membrane potential of pacemaker cells and its relationship, voltage, current curve. And this is a cell membrane equivalent circuit. And as you can see that all the cell membrane has a capacitive component and parallel resistive component. And the important thing is the capacitive current. It is the largest current to go through. When voltage change against small time change is proportional to the amount of the capacitance. Do you have a pointer?
No. Let me get him. I'll have a look at it. Yeah, maybe he has it somewhere.
Well, you can see capacitive current is proportional to the membrane capacitance and dV over dt. So, next question is, when you take an electrocardiogram, that corresponds QRS complex. So we start checking that. Did you find? Oh. Okay. So everybody understand capacitive current, which is proportional to the magnitude of the change of voltage per change of the time. So relationship with the transmembrane action potential. This is a ventricular cell transmembrane action potential and its corresponding surface electrogram. They have this waveform corresponding. This is for single cell relationship between transmembrane action potential and the corresponding surface electrogram. Now, among this, the biggest change dV/dt will be this equivalent of QRS complex somewhere around here. So we concentrated to find out if this is true or not. And this is a instrument I have right here, we use almost every day. This has the most common cancer slide, about 75 different common cancer slides. And as you can see in the inside, these are arranged from head to lower part of the body. And the last part is the blood circulatory system, and particularly bone marrow-related malignancy, which include leukemia and so on. Anyway, from this, we check this part where there is a maximum DVDT changes. And this is how we testing. And as you can see, I'm holding different cancer slides and see if there is an electromagnetic field resonance. Now, this technique was given by US patent because we found when you have an electromagnetic field resonance, to detect this, you need expensive amplifiers and special amplifiers. But we found using our human body, we get essentially same information without using any expensive amplifiers. And for that reason, we got a US patent for this method. And so using this resonance phenomena between cancer specific cancer slide, and if the patient electrocardiogram has same cancer anywhere in the body, we are able to detect it. And for example, the adenocarcinoma of the colon, we can detect, and from this area where there is maximum DVDT changes. And we also found when DVDT changes big enough, we can also get the exact amount of the cancer parameter, biochemical parameters. And in this case, integrin alpha-5 beta-1 or oncogen C4AB2 always increase in any malignancy. And when there is a DNA mutation, which always require for development of cancer, this last one, 8-hydroxydeoxyguanosine must increase. And we found that almost every cancer has a 2.5 nanogram with this, our system. And so we use this technique to find, what kind of cancer we can detect. As a conclusion, we can detect any cancer at any part of the body. So we just quickly show some of the examples. But I also want to see if we can detect any effect of the drug effect on the cancer too. And here we found optimal dose of the vitamin D3. They always reduce cancer markers significantly, but if it is an overdose, they always increase cancer markers, which means, you enhance the progress of the cancer. And contrary to some of the talk given yesterday, our study shows that 2,000 international units of vitamin D3 will increase the cancer marker significantly. This was before 275 nanogram went up 627 nanogram by just 2,000 international units of vitamin D3. But when we give optimal dose, which is, we found most of the adults is between 400 and 800 international units. And with that, we found significant reduction on the cancer markers. Before it was 200 something nanogram, it reduced to 0.002 nanogram. You know, these are not just 1 or 10 patients. We tried many, many patients. And then also we found by standard screening of the cancer by colonoscopy and anesthesia, and this middle-aged college professor, although he don't have any significant symptom, he went to check up to Columbia Medical Center, and the colonoscopy result indicated absolutely there is no colon cancer. But because of he knew my work on the electrocardiogram, he also asked to take electrocardiogram, and the electrocardiogram was told absolutely normal. But when I checked with this QRS complex, where there is a maximum DVDT change, we found colon cancer. That means there's only one possibility. The patient has a cancer, but cancer was not inside of the colon lumen. It's below the mucous membrane, so you cannot detect with standard colonoscopy. But with electrocardiogram, we can detect. Remember I said any part of the body we can detect. So this is another advantage. Also, interesting things we found, electrocardiogram, any part of the electrocardiogram produces strong resonance, electromagnetic field resonance with, if it's a man, Y chromosome. It's a woman in the X chromosome. And then when we did that, around that time, one of the CNN moderator, a reporter, I can't remember, he has a white hair and a young-looking guy, and he announced himself he's a homosexual. So we checked his. We did not have an electrocardiogram, but we checked his body on the television. We took a picture. Essentially, we found the Y chromosome resonance and part of the X chromosome resonance. And here's a prostate cancer we can detect. And we can detect stomach cancer. We can detect. This is a multiple myeloma patient, which is one of the bone marrow-related malignancy. And again, this maximum DVDT show multiple myeloma, just from this box, because we use this outside box. Outside we use as an antenna, so all the electromagnetic field coming from all the slide is here, and instead of testing each one, which takes many hours, but by doing this, we can detect resonance in a matter of 10 seconds. So it's a tremendous saving of the time. And here, he has a integrin 307.5 nanogram at maximum DVDT. And same thing with the oncogen C-phos AB2. And 8-hydroxydeoxyguanosine is 2.5 nanogram. So it's not particularly aggressive, but it is a malignant multiple myeloma. And in this patient, we tried again. This is before treatment, and we tried the effect of vitamin D3. When we use the vitamin D3, 400 international unit, it's 307.5 nanogram of oncogen C-phos AB2 reduced to 0.001 nanogram. You cannot get this kind of significant reduction in any cancer treatment. In other words, optimal dose of the vitamin D3 have a very significant anti-cancer effect. And similar, but when you use 2,000 or international unit or higher, cancer parameter increase to 200 something to 600, which is, you shorten the life of the patient. Now, this patient, I think, was diagnosed uterus cancer or something, I can't remember, but electrocardiogram shows a different result. It was ovarian cancer with electrocardiogram. Eventually, they found she has ovarian cancer. So sometimes you can correct misdiagnosis. And for this cancer patient, we checked the effect of 400 international units of vitamin D3, oncogen C-phos AB2 went down to a few hundred nanogram to 0.0005 nanogram. You cannot get any such a result with any chemotherapy or any treatment. But if you use high amount over 2,000 or 5,000, it promotes cancer. Now this patient also, she had a typical sign of the ovarian cancer. In ovarian cancer, they always shows up this area. It often shows up reddening and swelling and projections. And in the male, that area also have a problem with testicles. If you see Mr. Trump, the Republican candidate, what is his name?
What?
The guy always talk big.
Huh? Oh, Donald Trump?
Yeah. If you watch carefully, he has this. So we checked, we suspect first cancer. Instead of cancer, we found 5 times higher testosterone in here.
He's taking supplements.
And when you have a bone marrow,
You probably could find some other things too.
yeah, I did not check. Anyway, we see quite often, and also when you have a bone marrow related disease, this bone marrow related area, white area, they often show a strong abnormality. And also we use for that treatment. And we can show this change in electrocardiogram. Now, in addition, we found additional information we can obtain from part of the rising part of the T wave. And I can show you some of the important findings. Yeah, here's a, this is one of my latest patients whose husband is a physician.
Do you have a pointer, by the way? Yeah.
And, oh, okay. Anyway, in this electrocardiogram, we found she has a glioblastoma early stage and breast cancer. And, but when we check, breast cancer developed in a very short time of the period. And eventually we found the reason also, but we don't have time to go. But also integrin is very high. And, but when you have a 2 cancer and in this case, breast cancer was a palpable size. So we know that the main integrin or oncogene is due to this. And in order to have an exact amount, we found this peak-to-peak of the QRS complex is usually, if it is over 1.3 or 1.5 millivolt, usually we get accurate information. But below that information is less reduced amount. And so, but diagnosis, information concerning a diagnosis, it does not depend on the magnitude of the voltage, as long as there is a significant voltage changes. Thank you very much.
Excellent. Yes, we'll take a few minutes for questions. That was really very intriguing and important. We look forward to the publication.
Yes.
Yes.
This is a very exciting information. I was wondering, I know you have a patent on this device. How many people have you trained with this device, and have they been able to duplicate your level of success?
Well, right now you remember, we only succeeded end of last year. Before we were testing, we missed it because we are not careful. And so end of last year, I decided to spend every part of the electrocardiogram, a few patients with known cancer. And I found, this idea was correct.
Were you able to convince the people that when they had, like, say, a negative colonoscopy,
Yeah.
were you able to convince them to go in and try to find the tumor? Or was
Well,
there other imaging that they could
no, I told that, this professor, did not want to, directly, against his diagnosis. So I said, some of my associate medical doctor suggested there is a possibility of, colon cancer below mucous membrane. And the answer was that there is such a possibility, but he said, I doubt it. That's what the answer they gave.
So it wasn't confirmed?
Hmm?
So the cancer wasn't confirmed?
No. The person who did the colonoscopy happened to be one of the professor. He had such a confidence. He said, it may be possible, but I don't believe so. That was the answer.
Okay, I guess
Do you
we're.
have any idea of what's the sensitivity and specificity of this EKG detecting cancers, or that's not been done yet?
Well, so far seems to be we are able to detect most of the cancer with already diagnosed patient without knowing, about what cancer they have.
And
But the problem is when you have more than two cancer, we can detect two cancer, but we don't know which one is, how much cancer parameter, biochemical.
but you don't know what the false positive and false negative rate of this EKG detection is.
So far, we tested at least 100 cases. Only difference was that there was a few cases, contradicting, but eventually their diagnosis was incorrect.
Let me ask you, what do you think is the reason you see these EKG changes? What's your hypothesis?
What did you say?
Why does the EKG change? What causes the EKG to change
Oh.
in cancers? What's your
No, I already explained my hypothesis. When you have a high frequency component, additional information can be carried with that high frequency component. That's why we are using laser beam originally. Put the information on the slide the cancer information, and we found information can be carried bidirectionally through the laser beam. But the laser beam cannot penetrate too far. So, if the cancer is superficial, we can detect. But if it's, so that to test with the laser beam, we have to do at least front and back. So it takes twice time. But I was looking for something I can detect with one shot, and this is the result.
Thank you.